The sun is setting fast. Very soon it will be dark, and in this building at Kadama Health Center 3 are mothers in labor. This building is the maternal wing at the facility. For 2 days now there's been no electricity, and this is bad, especially for women in labor. The mother in this ward will likely give birth at night, and it will be total darkness at the facility. This is a common scene here.
We have the maternity ward. It's connected to the umeme grid, but we have rampant load shedding from the umeme. A mother can be in labor, a mother can be in the process of delivery, and power goes off.
Indeed, there is some hope now. Makerere University School of Public Health has partnered with Future Health Systems Consortium to assess how community empowerment strategies can affect service delivery and community capabilities. In Kibuku district, Eastern Uganda, a community and health facility scorecard for maternal and newborn health service delivery is being tested.
The Community Scorecard is a social accountability tool that uses community and service provider meaningful engagement for service utilization and delivery improvement. Often, it is used as a community monitoring and evaluation tool to improve service delivery and utilization.
The feasibility study aims at identifying facilitators, barriers and factors that could influence implementation, institutionalization, and scale-up of community and facility scorecards in Uganda. It has used local capacity at the districts such as local NGOs, volunteers, public sector workers and structures to build their capacity to manage community scorecards. Kadama Sub-County, where Kadama Health Center 3 is located, is one of the 6 sub-counties in the district where the scorecard study is being conducted.
Due to the activities and indicators,
this is a health facility scoring, and it is the 4th round of scoring. 2 new indicators have been identified, and one of them seeks to solve the lighting challenge in the labor ward.
And that alternative source of the lighting system has been the solar system. So if we have the solar system together with the umeme system in the maternity ward, it will also be an achievement for us.
To what extent does the community scorecard process incorporate and address the maternal and newborn service-related needs of the communities?
One of the key outputs here is the interface, where the community comes together with the health workers, and then they discuss the work plans they made, they discuss the scoring, how the community scored the health workers or the health service delivery, and also how the services are being offered by the facility.
The project was implemented in 5 health facilities in Kibuku district. The scoring was done every quarter. 5 rounds of scoring were done.
Having actually achieved almost green with all these improvements, we have seen it necessary to add on some 2 new indicators. And the 2 new indicators actually, one is actually to ease transport or to provide transport to mothers actually to the facility.
There have been remarkable improvements across the different maternal and newborn health service delivery performance indicators. These improvements were because of the several initiatives undertaken by the health workers at the facilities and the district leaders.
Involvement of communities, not health-related staff, in assessing health service delivery. So it has built capacity of communities to assess our health and facilities. That is a superb approach towards improving health service delivery.
Initially, we did not have enough delivery beds because initially we were in red. We moved to yellow. We are now in green. As a health center 2 facility, we now have like 4 delivery beds.
We had a few midwives, so now at least we managed to recruit another midwife, because when the number increased of the mothers, so we needed also to increase more skilled labor.
There have also been remarkable improvements across the different service utilization indicators. For example, the number of women seeking antenatal care within the 1st trimester increased among many other indicators.
When the scorecard came in, we started, sensitizing the mothers to save. And the saving was towards, say, transport, those things they need during labor.
Okugula ebintu okwetegekera okuzaala zembadde nga sikirimu omugaso nga sikirabamu omugaso naye kati njize okusinza ku projekiti eno maze okukiyiga nti kati woba nga oguze ebintu nowetegekera omukyala wo mu kuzaala takalubya.
We had issues with the midwives being very, very harsh to mothers. Other mothers could even stay home and deliver from home, which was risky to their lives.
Their attitude has changed now. They are looking at these people in a positive way and handling them in a positive way. Also a better method of resolving an issue, because it also gives the people they are talking about a chance to give a defense why they are doing such and why would somebody behave like that.
Above all, the district leaders have become more involved in community scorecard activities. For example, in Kadama sub-county, leaders lobbied for the completion of this maternity ward.
As an implementing team, we believe that this has been a very good model. Now, everyone understands that the family has to save for the mother's transport. The political leader has to encourage and do sensitization and lobbying for materials in the facility. The technical leadership has to look into budgeting for the health workers to have accommodation at the facility. The health worker has to deliver the service. If we need good health outcomes for the mother and newborn, we got to work together.